A specter of respiratory distress is haunting nations across the globe as a surge in pneumonia infections grips hospitals and clinics. In China, pediatric wards are teeming with young patients battling the relentless grip of pneumonia, leaving medical staff scrambling to cope with the overwhelming influx. Meanwhile, Denmark has issued a stark warning, bracing itself for a potential pneumonia epidemic. The Netherlands, too, has fallen victim to this alarming trend, witnessing a doubling of pneumonia cases compared to last year.
Subscribe to my channel for more informative videos on health and wellness. This resurgence of pneumonia, a potentially life-threatening infection that inflames the lungs, has sent shockwaves through the medical community. While pneumonia is a common ailment, its recent surge has raised concerns about its potential impact on vulnerable populations, particularly children and the elderly. Experts attribute this alarming rise in pneumonia cases to a convergence of factors. The relaxation of COVID-19 restrictions has led to increased social interactions, exposing individuals to a wider range of respiratory pathogens. Additionally, the circulation of respiratory viruses, such as influenza and RSV, has played a significant role in fueling the pneumonia outbreak. Furthermore, the strain of the pandemic on people's immune systems has left many individuals more susceptible to respiratory infections. Pneumonia is an infection that inflames the air sacs in the lungs, causing inflammation and fluid buildup. This can lead to a range of symptoms, including cough that produces thick or greenish mucus, fever, shortness of breath, chest pain, fatigue, nausea and vomiting. In severe cases, pneumonia can lead to complications such as respiratory failure, lung abscess, pleural effusion fluid buildup around the lungs, sepsis, a life-threatening inflammatory response. Factors contributing to the pneumonia surge. The recent surge in pneumonia cases is attributed to several factors, including as people resume pre-pandemic activities, the increased exposure to respiratory viruses has contributed to the rise in pneumonia cases. Circulation of respiratory viruses. The circulation of respiratory viruses has played a significant role in the uptick of pneumonia infections. The pandemic has taken a toll on people's immune systems, making them more susceptible to respiratory infections like pneumonia. Protecting yourself and those around you from pneumonia is crucial. Here are some effective prevention strategies. Is the single most effective way to prevent the spread of germs that cause pneumonia. Wash your hands thoroughly with soap and water for at least 20 seconds, especially after being in public places or touching your face. Maintaining a safe distance from others, especially when sick, can help reduce the transmission of respiratory viruses. In addition to the above measures, consider these tips to boost your overall health and reduce your risk of pneumonia. Eat a healthy diet rich in fruits, vegetables, and whole grains. Maintain a regular exercise routine. Get adequate sleep. Avoid smoking and secondhand smoke exposure. The surge in pneumonia cases highlights the importance of vigilance and preventive measures. By following the recommended strategies, we can effectively combat the spread of respiratory infections and protect ourselves and our... Remember, subscribe to my channel for more informative videos on health and staying informed, taking preventive measures, and seeking medical attention when needed are essential steps in safeguarding your health and well.